Caucus, Congressman Becerra.
Gentleman's recognized for 2 minutes.
I thank the gentleman from Texas for yielding the time. Mr. Speaker, to put everything in perspective, we're told by the American Academy of Family Physicians that today we can foresee a shortage of some 40,000 primary care physicians in this country in less than 10 years. Within another 5 years, that shortage will grow to about 42 to 46,000 primary care physicians. Graduate medical education funds does something very simple. It says to some of these clinics, some of these healthcare providers, that if you guarantee that you'll make graduate medical training available to our future doctors, then we will guarantee that there will be money behind that training so that there will be a consistency so that medical student can finish training. Well, we just heard that this money that's available to these healthcare providers, these clinics, should no longer be guaranteed. And so the question you have to ask if you want to become a physician and you're going through medical training, and certainly the question you have to ask if you're one of these clinics throughout the entire country where you want to train someone to be a family medical doctor, an internist, a pediatrician, an obstetrician gynecologist, a psychiatrist, a dentist, a pediatric dentist, someone who specializes in gerontology, you have to ask yourself, if I'm going to try to train someone but I don't have the resources to fully provide the education, how do I guarantee that medical student that I can be there with the funds to pay for that education, to pay them for the work you're going to be doing? You can't. And that's why GME is so important. But we were just told a second ago that this is a slush fund pot of money. Furthest thing from the truth. We're told that the real truth, when we heard someone say, one of the speakers on the Republican side say, we're going to delete this money. That's exactly what's going to happen, because if you don't guarantee it, it's gone. And so, Mr. Speaker, the truth is we have to make sure we can train the next generation of medical leaders, and therefore I urge my colleagues to vote against this legislation.
Gentleman from California.